The dementias are a group of disorders that include Alzheimer's, vascular, Lewy body, and frontotemporal. The risk factor increases with age, and they are less common in people under the age of 60. Alzheimer's is by far the most common type of dementia. In Alzheimer's disease, pieces of proteins called plaques form in the brain, disrupting the connections between brain cells. As more and more plaques form, they kill off cells. Problems with memory and language are the first signs of Alzheimer's, although the ability to recall distant memories is common even late into the illness. Vascular dementia, or multi-infarct dementia, is the result of either lots of very small strokes, also called transient ischemic attacks, TIAs, or a series of larger strokes. Whether small or large, strokes cause disruption to the flow of blood within the brain, leading to the death of brain cells. The person suffering from vascular dementia may display symptoms of stroke, such as physical weakness or paralysis, or slurred speech, in addition to confusion. Lewy body dementia is caused by the build-up of small clusters of proteins called Lewy bodies in the person's brain. A person who has Lewy body dementia may experience rapid changes in their alertness and concentration. They may experience falls as a result of feeling faint or unsteady. Some people experience vivid visual hallucinations, seeing things and people who aren't really there. These hallucinations can be difficult to treat because people with Lewy body dementia can be extremely sensitive to certain kinds of medication, particularly antipsychotics, which are typically prescribed for hallucinations. They may also experience rigid muscles and stiffness, similar to the physical symptoms of Parkinson's disease. Frontotemporal dementia is caused by a variety of abnormal proteins forming in the frontal and temporal lobes in the brain. One such protein is called tau. The result of an imbalance of this protein in the brain leads to cells dying, the growth of tumors, or swelling within the brain. Damage to the frontal and temporal areas causes changes in emotional response and in the use of language. For example, the person may show marked personality changes, such as selfishness, swearing, overeating, drinking to excess, or poor personal hygiene. If the temporal lobe is damaged badly, the person may experience difficulties finding the right word for an object, or misunderstand word meanings. It is important to remember that there are many types of dementia, and they are all characterized by cells dying prematurely, whether caused by a disease process or, for example, the abuse of drugs or alcohol. Take a few minutes to review the 4 causes of dementia we have looked at in this chapter.